let others. I'll just begin the and just like to know how many of you here just in the chat box, just do let me know. I've already appeared for the examination and couldn't get through. If you want to just say, just tell. And how many of you are freshers just going to appear for the exam? You can answer the first question if you feel like. I won't be forcing you to answer that. I know it will be, what is meant by to get fail and like what is meant by to get ridiculed and those waiting time and period. All those can be absolutely painful for you. Right. Yep. Most of you are freshers. Right. Most of you are freshers. Okay. That's fine. Didn't get through. It's okay. It's okay. It's fine. Perfectly fine. It's perfectly fine. If you guys didn't get through, it's okay. You guys will get through. Okay. Everyone has their day. When I appeared for PACES examination, first attempt, done. I waited and I prepared. Next attempt, I came out as RCP Hall of Famer by scoring full marks. So everything is possible if you guys can try and do it appropriately. Okay. Without wasting for any time, we are going to see the road to MRCP UK with MedExam expert. I'm Dr. Moses. I'm the medical director for MRCP UK. But unfortunately, these days, I'm not able to interact much with you due to back-to-back PACES courses and due to back-to-back exams. This is PACES exam season. For the next 1-2 weeks, I'll be held up. Then I'll be completely free for you all to sit and discuss a lot of things. All right. You all know about part 1 exams. Any point of time, anyone has a doubt, please don't hesitate to chat in the chat box. Please don't unmute your mics. It will be really disturbing for me and other people. So just leave a message in the chat box. I will answer every single person. I will answer every single person without failing. Every single person here, I am going to answer. You can take my word on that. All right. Okay. Let's start. So you all know about part 1 exam. It has around 200 MCQs, 100 plus 100, same day. It's no more paper-based. We had paper-based exam. Now it's no more paper-based. All right. This is the MRCP UK part 1 April 2024 exam statistics. Why I'm putting statistics is numbers speaks a lot. All right. Why I'm speaking statistics? No audio. Can others hear me or my audio is gone? Hello, can others hear me or my audio is gone?
It's audible.
Am I audible, right?
Yes.
All right.
Wait.
Okay. All right. Moderators, please help the doctor who is not able to hear me. Okay. All right. This is the MRCP Part 1 April 2024 pass percentage. Okay. UK centers is around 45.2. International centers is 45. So there is not much difference. All right. Both are in the equal competition. This time, surprisingly, I don't know how male candidates have a higher pass rate. Surprising. And white candidates has a edge over other race. And UK trainees and compared to non-UK trainees, see here, this is something even surprising. Non-UK trainees beating out UK trainees. Do you know why? Many of these people, UK trainees, are post-plat people. They work around the clock to make the ends meet. They work around the clock. Where non-UK trainees has the luxury of staying home and getting some time to prepare. So they have an edge over these people. All right. So this is the statistics. The next statistics I want all of you to show is how MRCP UK scoring is done. I already told you these are called equated score. How the equated score they arrive, for example, this is straight from RCP, nothing on my own. I'm not creating any statistics. You know how much I am good at statistics. All right. candidate score distribution show many candidates scoring between 475 and 625. These are the marks. All right. How they equate? Like I said, from the lowest to the highest, they're taking a midpoint. At that midpoint falls on to mark 540. So for the April, the criteria is out of 199 scored questions, 123 they should answer to pass. All of you clear? Please don't go and confuse yourself in your chat box or group and confuse me or confuse anyone else how it is scored, how many questions I have to mark. Right, it depends on different papers. On the last paper, it's 123. I would suggest don't be at the edge. Please make sure you at least get 140 correct. So you will be on a safer side. I want all of you to be on a safer side, not in a fidgety mode, whether I've done right or done wrong, whether what I answered is correct, what I answered is wrong. You shouldn't come out in a fidgety state. Once you're done, you should be confident. Yes, I went, I done my examination. It's absolutely fine. I'll clear and I should come out. Not in a fidgety mode. All right. Don't aim to answer 123 or 125 correct. Aim to answer 140 plus, or I would say 150 plus. Okay, that is for the safer side. Next, topic-wise performance. Let us see here, analyze like which topic carries the better marks and which topics most candidates are filing down. If you see this carefully here, the topic that has the edge, which most people answer correctly, is the shorter topics like your oncology and medical ophthalmology. All right. Then your clinical sciences, surprisingly. The worst performed clinical sciences, that is genetics. Wow. The worst performed topics are your clinical sciences again, biochemistry and other stuff. The worst performed topics. See here, this is worst. And other worst performed topics here, if you go around and see, are your biostatistics, your immunology, and again, cell molecular biology. Somewhere down the line, closer, your geriatric medicine, even your clinical pharmacology. These are the worst performed topics worldwide. Yes, it's very difficult because we don't have a standard for any of these things. They can ask just out of anything. You cannot sit and study entire subjects of immunology or anything. Coming to this is the RCP split out of the question for you. I'll tell you one thing. Though you find clinical pharmacology and therapeutics just 15 questions, not just going to be 15, it's going to be at least 70 to 80 questions. Only thing is, 15 questions will be direct pharmacology, but the rest of the questions are going to be blended with other subjects. It can be blended with cardiology, it can be blended with all these things. So apart from this, cardiology is there. Your clinical sciences, which carries the maximum in this list, but the maximum will be always going to be clinical pharmacology. Next to your clinical sciences. So these are the subjects you should be very strong, super strong, ultra strong. And we have a clinical pharmacology specialty lecturer and professor is going to come for us for this team. I'm not going to take clinical pharmacology. I'm more going to stick with the clinical medicine. That is my neurology and the ID, which I'm specialized in, and endocrine. So endocrine carries 14, gastro carries 14, geriatrics carries 8, hematology 10, ID and neurology again 14 and 14, oncology, medical ophthalmology, psychiatry, all this are this. But remember one thing, this is not always strictly followed. This can change. For example, I'll tell you one thing. There shouldn't be any biostats in part 2. Around in the last 10 years, 3 times they asked biostats in part 2. So nothing you can keep it like this is the absolute truth, this is the permanent. If they tell they won't ask, nothing as such, okay? They can ask anything, anywhere, at any point of time, and it's you who have to be ready for everything, all right? Then when it comes to clinical sciences, this is a split up of the subjects. The maximum questions are going to be coming from, again, statistics, beware. Then again from immunology, clinical physiology, clinical biochemistry and metabolism, where most people flunked. Clinical anatomy, you'll get 3 questions, they say. Do you remember in the last paper how much clinical anatomy we got? We got around 10 plus questions. That's why I'm always telling, though you are seeing it here, this is not an absolute. It can change anytime in any way. All right. So these are the application period for your 2025 MRCP UK course. I hope all of you have applied, and I believe a lot of you are appearing for. Right. So then the third date on July. And one more thing, there is no deadline. No deadline to finish MRCP. You can finish anytime you want. You can finish anywhere you want. There is no deadline. No deadline. All right. The 7 years period has been waived off. But they are given 6 to 7 attempts for each MRCP part 1, 2, and PACES. The 7 years period is waive off. Even if you can finish MRCP-1 now, after 40 years, you want to come and do MRCP-2, it's fine. Even after 100 years after you want to come back and do PACES, it's still fine. The period is waived off due to competition in the PACES lot. All right. This is about the examination. Anyone have any doubt about the examination so far? Just type in the chat box. First, I will clear it before I go to the next topic. Anyone have any doubt in the examination pattern or anything, please type in the chat box. Please let me know. I'm more than happy to help you guys. Nobody? Shall we move? Okay, just a second. So why our course? Okay, does MRCP-1 expire if you don't go for? No, it doesn't, doctor. That's what I said. It doesn't. That's why I said, even after 40 years, you can come back and do. Even after 50 years, you can come back and do. There is no more expiry period. It's done. You can come even after 1 year and do 2 years, 100 years, no problem. All right. Now, why we are different? What is going to be made different in this course? Now we have our updated core concept lecture, completely updated series of core concept lecture. So what is special in that? What is more updated? What I have to know about this? No experience is needed. Your MBBS pass plus degree certificate, it's enough. You don't need experience. Dr. Rashid has asked, yes, doctor, there is no experience needed for MRCP. Yes, I'm coming to that. There is, gap is not an issue. Dr. Rafia Wahid, gap is not an issue to passing MRCP. Gap is an issue to get GMC registration. We will worry about that. I'll tell you what to do during the time of your GMC registration, okay? Now, if you have gap, immediately try to sit and finish back-to-back MRCP 1 and 2. Dr. Rafia, this is for you. 1 and 2, immediately I want you to sit and finish. Quickly finish, wave of dust. Throw it off. Okay? Back-to-back immediately. Okay? Then immediately try to get into UK through MTI. If you have a gap year, easier way. If not through MTI, through some other pathway, get into UK or get a PACES slot, start seeing cases, clear the examination, and try to patch the gap year in a way I'm going to tell you. I won't be telling this now here. I'll tell in some other time. Okay. And Dr. Shilpa, and before that, okay, Dr. Shilpa, doctor, with this course, do I need to do any online Qbank link? I'm coming to that. Your question will be answered shortly. There's limited trials. Dr. Aida, what trials you mean? Can you just elaborate in the chat box? There is no limit, only 6 times you can appear, and one more they will give a warning. 7th time you can appear. After that, any part of the MRCP, you cannot take beyond that. 6 times and one more time, they will give a warning. And after that, nothing. That's the only attempt you can do. All right. So why we are different here? Okay, now we are going to come up with a specialized and updated core concept lecture. More than whatever you read in your notes, so-called notes that is being circulated all over the internet, we are going to rather show direct clinical videos, direct patients, direct approach, and everything in and out, step by step, even for the beginners to the advanced learners, we are going to teach. That's how our core concept lectures are tailored. How many questions are passing us, Dr. Khalida? That's what I had told you sometime beginning. Just rewind back the recording. I had answered you the question with the statistics. Okay. So specialized core concept lectures, we are going to begin for the first time with very much updated and very much covering almost every single thing that is available for MRCP UK. Then coming to the question banks, where say, do I have to subscribe past test? Do I have to subscribe past medicine? Do I have to subscribe one examination? Do you have to? The answer is no. Who had asked this question? Dr. Shilpa. Listen here, doctor. Our Qbank is the biggest Qbank available right now for MRCP. It covers all this. I hope you got it, right? This is the one-stop subscription where you will access all the MCQs from all the Qbanks, including one examination, including all the past papers. All of you got it? Everything is covered here now. Now nothing is left. One stop, one solution, core concepts, exam questions, everything. Even otherwise, what you will do for the questions itself, you will be paying thousands and thousands of dollars, and nobody's going to come and teach you any lecture. I'm not mocking anyone. You know how the lecture will be, right? You can see the difference between our lecture. You see, listen, then you come out. All right. Those core concept lectures are little updated one. Now the updated core concept lectures are on the way for you all. Okay. Now we are going to have the updated ones, not the old ones. We're going to have the updated ones. All right. We're going to have the updated core concept lecture, not the ones that is recorded. You can listen to the recorded ones if you want. There is nothing wrong in that. They are also fairly decent ones. Now we are going to have an updated one. Okay. All the updated core concept lectures, and especially clinical pharmacology, we have a newer title because clinical pharmacology I was taking for you all. All right, you know, I'm not a clinical pharmacologist. I'm not an academician in pharmacology either. I'm a clinician. Most of the time, I'm spending my life beyond patients and patient students. So this time we thought, why can't we bring a person who is expertised in the field? So let him handle. So we are going to let him handle that. A hematologist and a clinical pharmacologist is going to, hematology senior resident and a clinical pharmacologist is going to come for you on those subjects. He's a specialist. He will take care of those. All right. So you don't need to worry about learning clinical pharmacology from a stroke physician. Just give me 1 second, doctors, if you don't mind. Yes, doctors, I am back. I'm sorry. Somebody was at the door. I had to open. Yeah. All right. This is the second thing. The third thing is all the Qbanks. Listen to me once again very clearly. All the Qbanks, all the MCQs in the Qbanks has been worked about by one of us individually. No course. I bet on anything again. No course offer all this under one roof. All the Qbanks, let it be your PM, your PT, or OE, every single MCQs has been worked out individually for you by one of us. Every single MCQ. So suppose you are not getting a time to study, you have a mobile, put on your earpods, see the mobile, listen to the lecture, and you can keep going on. One of us will keep working out at least some ways, one or the other way, you will get reinforced. Your concepts are going to get reinforced in your head again and again and over and over. All right. That's one of the things from us. Next, All past papers are available from us. And again, every single past paper, including the latest past papers, has been worked out by the mentors. And most of the latest ones have been worked out by me, except biostatistics. Please don't ask the subject about the subject to me. There are specialists for that to handle that. Okay. 4. Number 5, this time, like I said, the clinical pharmacology being the topmost subject, we have a specialist mentor for that. A specialist is going to sit and work for you for clinical pharmacology. You're no longer going to learn clinical pharmacology with a stroke physician like me. You're going to go ahead and learn clinical pharmacology from someone who is expert in the field, who's going to take you through step by step, one by one. Okay. So don't worry about that. Number 6, I would say, just a second again, guys. I'm really sorry. Yeah, I'm really sorry, guys. Yeah. So we have supportive and as well as empathetic mentors in MedExam Expert available for you. You know, you can ask any one of the students who have enrolled with us, all the doctors and all the great candidates. We were always available for them. Of course, I may not be able to reply you immediately or instantly, but I never left any message unattended. One day, 2 day, I'm held up, I'll definitely reply. And all the people in our team are more than happy to support you all anytime you want, in whatever way you want. Okay. All right. 6th, there are systematic mock examination with progress reports. This time we introduced how which candidate is progressing, what is the average, which candidates needs to be dealt with what, because okay, every single thing. Yes, Dr. Amber, thank you. Everything. We are never letting go of anyone. We are like more like a family. We are ready to help each other to come out. All right, 7, there's going to be continued support. You can ask anybody who attended the course, anybody who had interacted with me, who had attended my PACES course also directly in India or anywhere else. They know how we are. We support you not just for part 1. We are not going to be like, you have paid my fee. All right, bye-bye. I got your fee. Rest of the thing is your headache. Go to hell. No, we are not going to be like that. You have issues with part 2. We have part 2 courses. We have our direct basis courses running across everywhere. In any help you want, we are more than happy to help you. Only thing, myself, I cannot guarantee I will be able to reply you immediately, but definitely I will tell you one thing, but your message or your query will not go unattended beyond 48 to 78 hours. One of us will come for your aid. Even if I'm not able to come, one person will be there. I'll be able to help you with that. Small doubts, you ask other people. Major doubts, you do. Not just spaces. There are 2 candidates here who needed to go to UK. I myself helped out with getting a clinical attachment. Okay, your letter of recommendations to anything. Letter of recommendation I can give only to people who living in the same geographical area. I cannot now write a letter of recommendation to someone I never met. So all these things we are more than happy to do that from our end. Happily we are able to we will do it. Okay. So this is not just going to be a subscription. You're paying the course, and after part 1, buy, you pass, you fail, nothing. You ask anyone who ever failed, we were ready to have a let's talk with them, work out with them, help them to come up from the failure and to find a solution for them and work out together a plan. All these things you will be getting here with us. That I can guarantee you. And one more question, do we need books for MRCP preparation? MRCP preparation doesn't require any books. Go through the notes that is uploaded. Okay, no books are needed. If still you want a textbook, then Oxford Handbook. If you want, only if you want, or you want a big book. Okay, small book is not enough. I want a big book, doctor. Then only some doctor directly texted me about the course fees. Please, some of the moderators will contact you, doctor. Okay. All right. Course fee, everything is fixed by the management and the course directly. fee is not determined me. I'm just determining what subject has to be taken and how it has to be taken and how it has to be taught and who are the ones who has to teach, what questions are there. I'm the academic section, okay? Notes and notes, I'm no one to comment on that. This is my opinion, what I'm telling you, because I cannot comment on anything. Even the biggest guy who wrote Step Up to MRCP notes, one Khalid Al-Maghrabi is my best friend. Okay. I won't talk about his note either good or bad. Neither he will talk about my places course or my MRCP course good or bad. So in general, if you're asking me, Oxford Handbook 1, number 2, the best thing you can do is, you can use is, apart from Oxford Handbook, if you still want to read a big book, that is Kumar and Clark. That is what I am telling in general. About other notes, I can't comment, doctor, because I never read such notes, right? To give a comment about that, I should have done that. I never read such notes. This is the standard way we follow. All these notes and all. The problem is some of them are outdated. By just reading the notes, you can't pass the examination unless your basement is good. Some people who are telling I passed the examination just by reading the notes, those are the people I will tell you. They have adequate basic medical knowledge. There are many of them are FCPS, MD, DNB, internal medicine people. Their knowledge is superb. So they just read the notes, go and pass. If someone fresh out of MBBS with no adequate medicine knowledge and they want to attempt the same thing, they will end up falling terribly. That will be a therapeutic misadventure for those people. They shouldn't be doing that. That can cause more harm than good. All right? That's in general. Okay, if there is a notes like this, people claim, I studied the notes, full notes I studied, I passed. Then MRCP pass rate should be 100%, right? If one book or notes can make them pass, everyone will get the book or notes and read. What a big deal. Everyone will have MRCP 1 and 2. It's not that like that. It differs from one person to other person. Same with basis examination. Some people will come 1 month, they will prepare, they will clear. There are people who are preparing for 5 to 6 years from now, still couldn't clear the examination. It depends from one person to other person. It depends from one person's foundation to other person's foundation. It depends upon one person's dedication to other person's dedication. All right. That's how it is. Now coming to how to prepare. This is something I want to write and show you. How to prepare. How you or I can prepare for MRCP examination. First thing, set a plan. Have your own plan. What you are going to do. Without plan, without thing, nothing. Just imagine a ship. You are in the ship in the sea. You don't have a compass. You will be simply sailing and you will drown. You should have a proper plan. What you are going to do, when you are going to do, how you are going to do, why you are going to do. Don't endlessly do MRCP for no joy. Have a clear plan. You want to go to UK, you want to go to Middle East, or you want to be in your country and do something great. Have a clear plan. Number one. Okay. Number two. If there is a question, please put the questions on the group, doctor. I am not available for 2-3 days. I will get back to you guys shortly. Okay. Number two, after plan. Okay. Then after planning, after scheduling, just start preparing with discipline. Once again, I'm telling you and I'm highlighting you discipline. Many people may not like the word. I'm telling you, I'm not here to give you any psychological or spiritual advice, but I will tell you one thing. Most candidates who are successful are disciplined candidates. Oh, yeah, then you may know, you may tell, I know a gentleman who gets drunk, he smokes cigarettes, and he just lives the life he wants, and he also passed the examination. What a big deal. It's okay, his basement knowledge will be fine. He could be an expert and he'll be playing with all the stuffs, but every one of us cannot do that. So have a disciplined preparation. Set out certain time of every day. 6 hours means 6 hours. That's it. Nothing you are going to do. No mobile, no social media during the time. I would say chunk the social media till your MRCP preparation is done and you get the PACES MRCP degree in your hand. that is of no use. It will waste your time. Stop scrolling through your Facebooks. Stop scrolling through your Instagram posts. Stop scrolling through your WhatsApp status. Use the WhatsApp, see the message. That's it, done. Stop scrolling through all the status messages from morning to evening. Who is watching? What is he doing? What is he doing? Replying them. Stop that. Prepare. Stop endlessly spending time. I'm not telling you shouldn't relax at all. Once in a week, you go out, want to go for a shopping, movie, want to go for a party, pub, whatever. Keep it limited. Rest of the time, dedicatedly study. Then other thing is have a study partner. Please, this is extremely important. Without a study partner, it's going to be impossible and it's going to be absolutely tough. All right. There is one page, one MRCP film, they are trying to bring out AI study partners. They no longer trust humans. So artificial intelligence are going to come and sit and study. All right. It's on the trial. So that's the thing. Have a good study partner. Prepare discipline. All right. Then how to break up things inside. Once we have done with all the three things, how are we going to start? Start with the core concept lecture. Okay. Listen. Please take notes. And add more notes to the notes section from notes section in the MedExam Expert. Next, MCQ workout. After listening, one more thing, don't forget revise. Then MCQ. Work out all the MCQs in the Qbank. And whichever question you are going to go wrong, note it down. Discuss with a colleague. Discuss with someone. Discuss with your junior. Find out some juniors. Tell, I'm preparing for MRCP. You can come here. I'll teach you something. Maybe it will help you also. If you want to go to UK, it will be helping you out. MCQs, core concept lectures, then MCQs, then revision lectures, revise, then take short test, then watch past paper workout videos and work out the past papers. Then again revise, then again revise. If you do this, I don't think for any reason you will fail if you faithfully do this. And above all, discipline is very, very important. Unless you don't have a focus on studies, this is not going to help. So tell your family members, tell to yourself, tell your academics, I have an exam, I am going to study. Please don't disturb. Let it be whoever, your parents, your spouse, your children, whoever. I have an exam. I need some dedicated study time. Only for MRCP, if you honestly study really well in this manner, 1.5 years is more than enough to clear and get the MRCP degree in your hand. Just 1.5 years. Because we are reinforcing all the concepts which you even needed for your PACES examination here from the beginning itself. All right, how to do a final revision? Final revision should be in the form of taking examination, and reading through the notes. These are the two things. Frequent test, notes, note down the wrong things, again and again, over and over, again redo it so that till your concepts get reinforced. So 3 months of preparation is enough. It entirely, I'm telling you, 3 months enough, 6 months enough. It entirely depends on how much you know. You are good in medicine, you are a medicine resident, 3 months, fair enough, you can clear. Either you are a medicine resident or you're good in medicine. You are straight out, you are scratching your head, you don't know what to do, how to prepare. Please give yourself 6 months at least and don't do any adventurous attempt because I don't want you to get hurt at the end of the day after doing any such attempts. Oh my God, he told I went and appeared for the examination. I couldn't clear. It's really sad. I don't want any one of you to feel like that. Should you feel like that? Absolutely not. None of the candidates, none of my candidates should feel like that. All right. This is about MRCP examination in general. Any doubts here? Any doubts here? Please type in the chat box. I'm here to answer you all. Please type in the chat box. Any doubts here? Please type. Anything about MRCP you want to ask? Type. Nobody has a doubt, not a single doubt. If someone has prepared exam 50%, doctor, please don't do the misadventure, okay? If you have time, if you have money, you go on up here. Okay, thank you, Dr. Everything clear? If you have money, if you have time, you go and do that, Dr. Aisha, but I wouldn't do that if I were in your shoes. Because at the end of the day, if something goes wrong, I'm not being negative or anything, something goes wrong, it's you who will actually, have issues with that. I don't want you to get heartbroken at the end of the day or go and sit in a fear. So your first attempt should be the best attempt for part one and part two. Not more than 8 to 9 months you should spend for that. Okay. Notes, like I said, take the notes down and take the notes from the newer updated core concept lectures. Okay, these two notes should be enough. How will you get the past papers? Past papers are with us in the subscription. Otherwise, you have to spend for past test. You'll be paying the same amount, but only to get the past papers. But with us, you will get the past papers. You will get all the Qbanks. You will get all the lectures. You will get all the tests. You will get all the support. I'm being very honest. Registration process, that link has been already sent. Past test is good or past medicine is good. Both are good. But past medicine, I will tell you, it is being written by students. Past test is written by MRCP finished professionals. It's true. It's true. I told you how to study, how to go through. So go through the lectures. If how you are reading is right or wrong will be determined if you grab a past paper and work out and tell me how much percentage you got. Dr. Nusaiba. And registration process, everything will be told. Sometime first attempt gave, no exam will be. How will get the past papers? Past papers are with us. Okay. Website, it's mostly of read online, offline. I think you can download some notes. It's fine. And other notes of core concepts you have to take because core concept, I don't give any notes. You have to sit, listen to the lecture. It will be available for offline for the subscribers. You have to take notes with your hands. Why do you think people greats like my mentor, Dr. Najib, is not releasing any book or notes? Because he wants everyone to have the habit of taking notes. Such a big guy in medicine, right? Dr. Najib, I hope all of you know, right? He doesn't release a note. There is no notes of Dr. Najib. It's the people who are making some silly notes out of him. Is it 1 hour class? Yeah, he has notes, but not a lot. Recently, due to people pulling out, he released something. But other notes are what these people made. What he always says, listen, take it down. Then only it will go into your memory. Just by reading some notes without listening anything, without understanding the concepts, it's not going to be of any help. Core concept lectures are not going to be 1 hour class. Core concept lectures are going to be 4.5 hours class because you are going to cover entire neurology. All right. Anything else? Any doubts? Any doubts? Anyone? Any clarification? I'm more than happy to do that. Any others? Any other doubts? Nothing? If no doubts at all, I'll just end the session here. Thank you everyone once again for coming all the way. Schedule, everything will be given in advance. All right. Thank you everyone for coming all the way. Thank you very much. I wish you all the best in your preparation for your MRCP part 1. And we are here to support you throughout. All the very best. Have a great time ahead. Thank you so much. I'll see you in one of the free lectures. Okay. Registration, everything will be told by the people. Okay. Is it possible? Is it possible to register GMC with a big gap? Who's that? Dr. Rafia? Yes. I told you this question I will answer separately. Okay. All right. If you have concerns about GMC after finishing MRCP or at least after finishing MRCP-1, you are more than welcome to text me personally, not here. Okay. Thank you. Thank you everyone so much. Good night. Have a great day.